Ruth works for a community-based organization in Homa Bay that focuses on getting health services to women in the community. Ruth's organization is running a campaign to teach parents and educators about HPV and HPV vaccinations to help protect people from different kinds of cancers caused by the virus. Ruth will be working with a local school to build an awareness campaign. She'll be working with the head of school and teachers to build their awareness about HPV and then have them help her educate the families about HPV and getting vaccinated. Welcome to this unit on what is HPV. By the end of this session, you'll be able to explain HPV to others, explain how someone gets HPV, explain the risk factors of HPV including cancer, and understand ways to prevent HPV, including the importance of vaccination. So what is HPV? Human papillomavirus, HPV, is a sexually transmitted infection. It is a virus that can cause skin warts, genital warts, or some types of cancer in the throat, genital organs, and the cervix. HPV infections are very common. Nearly everyone will get HPV at some point in their lives. How is HPV transmitted? HPV is spread through intimate skin-to-skin contact. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus, even if they don't have signs or symptoms. More than 40 HPV types can infect the genital areas of men and women, including the skin of the penis, vulva, the area outside of the vagina and anus, and the linings of the vagina, cervix, and rectum. They can also infect the lining of the mouth and throat. HPV can cause genital or skin warts. There are a variety of cancers associated with HPV, including cervical cancer, anal cancer, throat cancer, penile cancer, and throat or mouth cancer. What are the risk factors for getting HPV? 1. Sex with an infected partner. 2. Sex with multiple partners. And lastly, a partner who is unfaithful. All increase the risk. Many people with HPV do not have symptoms, so they might not know, and therefore it is easy to spread it around unknowingly. What diseases can HPV cause? Most HPV infections, 9 out of 10, go away by themselves within 2 years. But sometimes, HPV infections will last longer and can cause some cancers. HPV infections can cause cancers of the cervix, vagina and vulva, penis, anus, back of the throat called oropharyngeal cancer, including the base of the tongue and tonsils. There are tests for some types, but not others. The testable ones. If genital warts are present, you have HPV. For the females, it is important to have your cervix checked with a pap smear test to assess for any changes in the cervix that may be caused by HPV. Non-testable. There are no tests yet to check for HPV in the mouth, throat, or in males. How can you prevent HPV? Number 1, HPV vaccinations prevent cancer-causing infections and pre-cancers. Number 2, cervical cancer can be prevented or found early through regular screening and follow-up treatment. And number 3, you can reduce the risk of getting HPV by using condoms. However, they are not 100% effective. Ruth understands the seriousness of getting people vaccinated, but is also aware that there are a lot of social stigmas surrounding vaccination because HPV is a sexually transmitted disease. In the next session, we will learn about the importance of HPV vaccination for children, adolescents, and adults to help keep them protected from the virus. Also, we will understand the misinformation surrounding the vaccines and how to combat them.